Trauma Nurse Coordinator here at Delta Health, and we are going to do a Trauma Talk video. Trauma Talks are a collaborative effort between Delta Health, Montrose Regional Health, Gunnison Valley Health, Telluride Medical Center, as well as community, Intermountain Health. What we do is we come together as a group and we look at the highest rates of traumas, and we do injury prevention and outreach based off of those. So this month's Trauma Talk for March is preventing burns in children. There are a couple different areas where your child is most likely to get burned, one of which is in the bathroom. So it's important that you set your hot water tank to 120 degrees Fahrenheit in order to, preemptively prevent those burns. If it's set at that temperature, you're less likely to get such a high injury. Also, it's important to never leave your child alone while they are in the bathtub. I mean, you have drowning risks as well, but also this prevents the likelihood that they're able to turn that hot water on by themselves and go unsupervised in that kind of water. The next and the most common place for burns to occur is in the kitchen. So you don't want to hold your child if you're preparing, hot meals, hot drinks, or even if you're eating or drinking them, just because kids are wiggly and the likelihood of you spilling on them can be kind of high. Another important note is to keep the hot food away from the children. This kind of, again, goes without saying for any of my parents, but keeping them away from the children till it cools off so that they can eat or drink it safely. When you are cooking or pouring beverages that are hot, keeping the handles away from the children, turned away on the stove or away from the ledges so that they can't pull it down on top of themselves and cause that kind of burn as well. You might consider placing a fire extinguisher in your kitchen. It's important to know how to use it if you do that as well, but that can be a helpful tool. In the bedroom, one of the key points I want to mention is ensure that night lights are not touching fabric such as curtains. And if you do have fabric hanging, making sure that's out of the way of any radiators or anything that's also a fire hazard. In general, having a smoke alarm on every level in your home is important, as well as testing those batteries frequently to make sure that they're going to work in the event of an emergency. Good rule of thumb, we just had daylight savings time. If you didn't already, check your batteries now, make sure that they're working and functional in case of an emergency. Also, I just want to note that it's better to prevent a burn injury than it is to treat one. There's a lot of pain and a lot of time that goes along with a burn injury, so do what you can to take the steps to go ahead and prevent those.